Welcome back to the Childhood Cancer Perspective, and thank you all so much for sticking with me through all of these episodes as I detail the journey, or as we like to call it here on this show, the shit show that is pediatric cancer, as we went through it with our daughter JC when she was diagnosed with choroid plexus carcinoma on January 30th of 2020. She fought for 520 days and unfortunately laid her sword down on July 3rd of 2021. Since that day, we have fought hard through advocacy and through this podcast, through social media, everything that we can do to create awareness around pediatric cancer. One thing that was brought to light today that I actually want to speak about, and I think it's something that's very important and something that maybe it's prevalent in a lot of other areas, but I think when it comes to parents that are going through something with their child, I don't really think that as parents or caregivers, we are given the respect that we deserve when it comes to understanding exactly what is going on a day-to-day basis. Now, I will tell you that as your parent or as a parent, you are your child's greatest advocate. You are the one that is there being their voice when they cannot speak, being their voice when they're too young, when they're going through treatments, whatever the case may be. You are their voice. You are the one that is giving all of that energy, and you're giving all of that information to the doctors and the medical staff to let them know exactly what is going on. You are going to be able to understand what your child's baselines are. You're going to be able to understand what is normal and what is not normal, way far beyond what any medical journal or any medical school will tell you. And that's the difference here. Lately, a lot of things, now we go through these kind of spurts of things on social media where people will decide they want to latch on to something, and then they want to act as if they know better what's going on simply because they're in the medical field. And I'm here to tell you that as parents that are in this space, as people that are in this community, we understand a hell of a lot more than we are given credit for. And our kids understand a hell of a lot more than they are given credit for. But as being their biggest advocates, you have to understand that what you say has to be confident, you have to be strong, and you have to be willing to fight for what you believe in or what you believe is right and what you believe is wrong. Even if that means your team and the protocol or even the location that your child is receiving their treatment has to change. And that is just simply something that comes with the territory. Now, I bring this up because today we had the opportunity to share our story with a good friend of ours that is doing something in honor of Brain Cancer Awareness Month next month. Now, speaking about it today really brought back a lot of memories. It was actually really hard at some points to really speak about it because we went from day one all the way until the day JC passed and all of the details in between. And what we really came across and what we could agree upon as being families within this community, both of which that have lost a child, is that we are not listened to and we are not focused on enough when it comes to trying to get diagnosis or trying to get information or get people to listen to what you're saying. We're all too often just pushed to the side, all too often just told, this is what's best, this is what's going on, this is what's happening, this is what you need to do. Treat them and street them. You're out of here. And if you continue to come back and continue to push to try to get answers, to try to get information, a lot of the times you are labeled as a problem patient or a problem parent, or it could even go deeper to make it seem like you're making your child sick for attention, or making them think that, or you're being made to think that you're crazy, you're nuts, like you're making this up in your own mind because you're not getting the answers that you want. And it's an unfortunate thing because I think in the long run, there may be a certain amount of parents or a certain amount of people in general that may just give up or may just stop because they really start to truly believe, almost like a Stockholm syndrome. They truly start to believe that they're wrong, that they're crazy because they can't figure out what's going on. They know something's wrong, but they're being told over and over and over by multiple people that nothing's wrong. Now, in JC's case, it was a few months, really. It was almost a few months of back and forth with my wife taking her to our pediatrician, multiple different doctors within that pediatrician's office, to the ER, to urgent care, trying to figure out what was going on. Because when it comes to your child, you, like I said before, you're the baseline, which means you know if something is wrong. And What was going on with Jace was not right. There was something that was truly off, and we could not figure it out. And every single time she was taken into any of these offices or to see any of these physicians, it was always cast off as, okay, she's got some type of gastrointestinal issue. We're going to set you up with a gastroenterologist. We're going to get a CT of her belly. We're going to get all these tests done to prove that it is something having to do with her stomach or her intestines. All the while, she's continuing to feel sick. She's continuing to feel like crap, and it's a weird set of circumstances that the way that these symptoms would come about. And the reality of it is that I still, and it, kind of brought it up again today, I feel horribly guilty because there were times as we were moving through this before a diagnosis came that I thought that it was bullshit. I thought that she was getting the attention that she wanted, and JC getting the attention she wanted. I thought that she doesn't feel sick, but she loves. Maybe she does, but it's not as bad as she's saying that it is, because it was odd. Her symptoms would be at one time of the day, but not another time of the day, and it seemed to kind of go along that same path for such a long period of time. And once the diagnosis actually came and we knew what it was, looking up the symptoms of that type of tumor, those symptoms lined up with exactly the way Jace was feeling, exactly to a T the things that she was going through. And that's what it's a shame, because I understand on one hand that doctors in a sense are not going to be looking for that out there most extreme answer in the beginning. They're going to look for the easiest, quickest answer that could make you feel better. A kid coming in that's not feeling well, that is showing the symptoms of being constipated, or is showing the symptoms of just having caught some type of bug, having something like that, or headaches, or pain in their arm, whatever. It could be any multitude of things. They caught the flu, they strained something when they were just playing too hard. They caught something going around the schools, because we all know they're just one big damn petri dish. And to think, okay, well, this child came in and, okay, well, absolutely, she has cancer. No, that's not the way that medicine works, and that's not the way that these doctors work, and I understand that. I don't agree with it 100%, but I understand it. So the first time, the second time, even the third time that she was taken into the doctor with these same type of symptoms that were not being cleared up with what they were prescribing or what they were suggesting, should have set off alarm bells that maybe something different needs to happen. And the honest to God thing is that if a certain symptom did not happen for JC on an off chance, which was the fact that one day, looking directly at her eye turned inward. Just one eye turned inward. Our daughters noticed it first, and then I noticed it. And if she turned her head, it almost like her brain reset. But then once she looked at you directly, that eye would just turn in. And it was noticeable. And as soon as that happened, it was like, okay, this is something new. This is a symptom we haven't seen before. We need to get her in, and we need to get this checked out. Now, once that was looked into, it was noticed that she had swelling in the optic nerve. Now, swelling in the optic nerve can mean a lot of things. But the one thing, when that diagnosis of swelling in the optic nerve came back, now I was at work, okay? My wife had to take her for this test. When that came back, the first thing that pops up when you type in swelling in the optic nerve is possible brain tumor. Now, I am an optimist at heart. My wife she comes from a family of realists, okay, which means that it essentially you're looking at the worst case scenario first. I refuse to go to that worst case scenario because I don't want to think that that's what the issue is. I would rather think that it's something that we can handle. It's something that is not as intense. I don't want to think that, okay, oh my God, her eye turned in. She's got, she has a brain tumor. And I didn't want to think that. Like, I guess I kind of put a wall up. We've talked about that before, where I kind of shut that part out. And my wife was immediately, it could be a brain tumor. And I said, you got to stop. You can't talk like that. You can't think like that. We have to think positive. Now, when that was discovered, we were sent to our children's hospital here right away. And once we were there, then, the testing revealed that it was in fact a brain tumor, and it needed to be removed in order for any sense of recovery. And so we went through with that. Now, leading up to this, like I said, it was a lot of back and forth with doctors, with pediatricians, with anybody along that was connected to that, with the gastroenterologist. Now, we never actually did that because the gastroenterologist appointment was supposed to happen after it actually was it happened, or it was set up after the diagnosis and everything had come. So had we waited for that, how much worse would this have been? We have no idea how much worse it would have been because we didn't get to that point. But we also don't know how much worse it got in the back and forth that we went through for months before we actually got a diagnosis. Now, those we'll call it 6 to 8 weeks. We'll call it 2 months. In that 2 months, that tumor could have, because this is known as a very aggressive tumor. If that in that 2 months that tumor grew just enough to the point where it set the fate in motion, then that's that point of you cannot let off the gas. And if it didn't, we'll never know. That's not one of those things that we can truly ever understand. But what I will tell you is that's why we always say you can't take your foot off the gas. If you truly feel that there is something wrong, if you truly feel that something is not right, you know what your child's baseline is. You know what is a good day. You know what is a bad day. You know when they're not feeling good. You know when something is just not right. Their attitude, their energy levels, whatever the case you know when something is not right. A doctor can come in and say, this is what their level should be based on their age and size and height and sex and weight and everything. You know that's just a graph, okay? That doesn't mean that your child is going to line into that graph exactly in every single aspect, which means you know their baselines. You know exactly how they should be, and when something's off, you as a parent know. And that means if something's wrong, you got to fight for it. You got to make sure that those doctors and those nurses and that urgent care, the ER, your pediatricians, whatever the case may have, you got to make sure you say, listen, I understand that it looks like I'm crazy. I understand that I've been here a lot, but you have to understand these symptoms haven't subsided. I'm not telling you that this is exactly what it is, but what I am saying is that there's something wrong. There's something not right, and we need to address it before it continues to get worse. Because unfortunately, being pushed off and being made to think you're nuts is just a common theme. They don't want to believe that a child could come in and have any type of ailment that is something that can't be quickly diagnosed. And in this instance, our pediatrician actually called us after the diagnosis came through. And, because she was the one that referred us back out to the children's hospital and set things up for us to be out there. She called us afterwards and she apologized. She apologized for not catching it. And it wasn't that we didn't accept her apology. I think we felt that she truly, as a person, not as a doctor, as a person, felt remorse for the fact that she didn't catch what was not so obvious. I guess if you put it that way. It is, if you went back on the very first day that she was taken into an ER, or even the second day she was taken into the pediatrician's office, and you take every symptom she had, and if you could say, okay, here's what she has, line it up with the symptoms of choroid plexus carcinoma, then yes, you could say, you know what, we need to have her tested for this. We need to have her tested for this because you have it all lined up. Until then, you are throwing darts at a board. And unfortunately, I think too many medical fields and too many doctors, I think they would rather do the treat them and treat them. They would rather get as many in and as many out as possible versus spending the time to find out and dig to the real root of the problem. And I'm not saying this is all doctors and all physicians, all nurses. I'm saying that there is a vast group of them that this is what they do because maybe they're not funded well enough. Maybe they don't have the help. They don't have the time. They don't have the manpower. Whatever the case is, it's hurting our children. It's hurting our population of children that are not going to be able to grow up and have a great future if they're not being able to be taken care of in the best and most efficient manner possible. And we saw this all too often. So getting into that diagnosis, that's the way we felt unheard. When we got into her treatments, we were essentially given a treatment plan and told, this is what we've come up with. This is the best option. let's go. We had no idea that there were other options or other choices. We had no idea that there were studies or hospitals or anything else that we could have reached out to for second opinions. We had no idea. There was no way we could have known because we were in a state of shock throughout the entire thing. A state of really trying to get a grip on life and get a grip on everything that was happening. So no, I think in that situation, I think we failed. I think we failed because we did not either have the time or the opportunity to do the research that we needed to do in order to get the best outcome possible. But we did the best that we could. And that will forever haunt us, I think, because the options that came later or the options that we looked up later were not anything that would have worked at that time because of the steps that were taken in the very beginning. And, throughout the treatments, we met doctors, we met nurses, we met, different types of specialties and things like that. And there were a handful of people within that line of people, the line of people coming into the room and coming into our treatments and all that kind of stuff that we did not like. There were several people that were no longer allowed to be around Jace because they did not listen to us. And like I said, you are your child's biggest advocate. If you feel like something's wrong, now if it's not something that's wrong with your child, but it's something wrong with the way they're being treated, that's the same thing. You need to make sure that you are advocating for that cause and advocating for their best interests, advocating for the health of them and giving them the best opportunities that they have to be able to thrive in whatever treatments or whatever therapies they're going through. We had one doctor that we met in the very beginning, actually, that we didn't have an issue with. In fact, we actually kind of thought he was a nice guy, and he was the one that actually released Jace to come home after her initial hospital stay. And so we didn't have an issue with him. And I ended up coming across paths with him again after she ended up having a seizure and she needed to have her shunt fixed. Her shunt it was not working correctly, and so they had to fix it. And I met him. I talked to him on the phone. Things were fantastic. I talked to him the next day in person, and I felt like he was a bit of an ass. And I felt like he was offended that I wasn't satisfied with what was happening with Jace, because at that point she wasn't responding the way they said she would be responding. She wasn't bouncing back the way that they said she'd bounce back. She wasn't showing any signs of getting any better. And it was, okay, we're doing everything when I can. And I literally said the words, but we didn't do anything. You have done nothing. And he seemed to get frustrated with me and frustrated with the point that we weren't getting the answers or he wasn't getting the responses that he felt like he deserved or felt like he was going to get. And I was unhappy with him. From that moment forward, I never saw him again. And we had another surgery that had to be redone on her shunts. And we mentioned to the neurosurgeon that we initially had, we do not want him there. We want you there. We do not want him there. We do not like the way that he treated us. We don't like the way he treated Jace. We do not feel comfortable. And that is your right. And I want you to be 100% in understanding of that if you come across a doctor, a nurse, a surgeon, any kind of a person that's coming in and out of your room or any out of your therapies or your treatments or anything that you encounter in the hospitals or anything like that, you have every right to say you do not want that person near your child. You don't want them doing anything near your child because you don't feel comfortable. You don't like their bedside manner. You don't like the way that they looked at you, talk to you. You don't feel that don't feel like you're getting the best treatment. You have every right to say you do not want them as part of your team. And that is again, do it if you feel that way. Okay, there's nothing saying that you can't do that. As a matter of fact, I would rather that somebody say, hey, I don't want them on my team, than for you to be sitting back every second and understanding that there are times when you have to leave the room or times when your children have to go to MRIs or CTs or go into surgeries or go to testing where you're not able to go in and you can't be there every second. Therefore, you want to make sure that people that you don't want around are not there when you can't monitor it. So that's something that's important. And again, that gets a little bit more extreme, but I guess it goes back to my initial point, and something that really kind of came to light a little bit more today is that you have to make sure that you are that voice. You have to make sure that you never give up the power of being the voice for your child. You never give up the opportunity to speak for your child in the best way possible. You never give up the opportunity to allow your voice to be the most important thing in that room so that your children can get the absolute best 100% care that they deserve. That is something that is incredibly important, and it's unfortunate that you have to get to the point to say that, and I bring that up because as you know, being in a children's hospital, you should be able to trust everything and everybody that's coming into that room, because that's a job, that's a path they chose to take to be able to work with children. And so therefore they should be there to respect you, respect your wishes, and respect your children more than anything. And if you can't do that, as you can't as a person, you can't do that, then you need to choose a new profession. And that's just my opinion. You do what you want with it, but that's the way that I feel, and I think that's the way a lot of people feel. I forever will wonder why anybody would want to mess with a medical parent, somebody that is watching their child go through the worst thing in the world, whether it's cancer or some other type of disease or ailment. They're going through it, and you are then spending your time and your energy trying to cipher through the people that should be around your child. And that's not where you should be spending your energy. So I would say, in general, that you have to be loud and you have to be confident. You have to understand that even if you don't truly get every single aspect of what is happening at that moment, if you don't understand every single point of the drug that they're using, every single point of the therapy that they're using, or why a certain physical therapy or occupational therapy, whatever, you don't feel it, the understanding of why they're being used, or you don't understand why a certain surgical procedure is happening or will not happen, or a test is not being offered, speak up. That is your chance to speak up. That is your chance to make sure that you're heard. That is your chance to stop things before they happen and they get worse, and then you can't fix it. And again, you can't also go in thinking that people know everything, that they understand everything about your case. You understand that when you're in there, you might have a dedicated oncologist, but that oncologist has probably got 40 other patients. And your surgeon may have 20 other surgeries that day. And the nurses, they're in and out of every single room all day long. They may be amazing, and we met some incredible ones that would always know your name when they came in, always knew what you liked, what you wanted to, what TV shows you like to watch. They knew everything. They were incredible people, but you can't expect that they all know everything that's going on. Or a technician that's just coming in to do an X-ray or to draw blood. You can't expect that they understand your case. They got an order, and they're there for that reason. Now, when she was finally flown to Milwaukee for the last time where they told us there was nothing that they could do, I remember getting there we got there just in time. Now, she was life flighted from Green Bay to get to Milwaukee. We got there just in time to stop a nurse from drawing blood from her by giving her an IV. And this nurse had no idea that this child coming in was an oncology patient, that she had a Hickman catheter. She had a port where blood could be drawn and medicine could be given. There was no reason to draw blood by sticking her with a needle, especially in that time when we weren't there and able to be there and comfort her. She had no idea. Also, when we got there to Milwaukee on that specific trip, that last one before she was brought home for hospice care, the oncology team had no idea why she was even there. You can't, and because the team in Green Bay had not properly relayed the information to why she was being airlifted there. So you can't assume that because a new doctor comes into the room or because a new nurse comes into the room that they understand or know your case 100%. They should know what they're coming into, but they may not know you. They may not know your child. They may not know the background. And that can be the difference between good treatment and great treatment. You have to be an advocate. You have to be a voice, and you have to be strong, and you have to be confident. You can be wrong. okay, about what you're asking. You can be wrong about what you're requesting, but you've got to be very confident in what you're asking. You cannot go in bringing up that or showing any sign of essentially weakness or any sign of flip-floppiness. You've got to go in there and say, okay, listen, this is a drug that you're putting into my child. But do you understand that these are the kinds of side effects that it could offer? Do you understand that this is something that we don't agree with, and whatever the case may be, or I wasn't explained why this would be bad or why this would be good. You got to go in there and you got to fight for what you think is right. Okay. I mean, there was a specific drug when we were in Milwaukee for her stem cell transplant. It was called Thiotepa, and Thiotepa is the only type of chemo drug that will excrete through your pores. So which means that for anybody getting it, that every couple of hours you have to take a bath because you have to wash this stuff off, otherwise it will burn the skin. It will leave literal burns on you. And like even as a parent, when I was helping JC with this, you're not supposed to touch it. You're supposed to use a soap. They give you a special soap that you use to clean them off every time. And in your mind, you like that kind of thing. You have to understand. You really have to think about that. This is the only type of drug that will excrete through your pores and burn you, and you can't touch it because it will burn you. What the fuck is it doing to the inside of your body if it will burn your skin? Just think about that. And I understood that this was part of her high dose chemo. But when I say 520 days. 520 days from the day she was diagnosed until the day she passed. And in between those days was wall-to-wall treatment, whether it was chemo or radiation or stem cell transplants or MRIs or CTs or testing or PT or whatever. It was wall-to-wall treatment. And when you look at it and say 520 days, you had plenty of time to research, or you had plenty of time to voice your opinions. And yes, we did have time to research. We did have time to voice our opinions, and we did voice our opinion. Like I said, there were doctors and nurses that were no longer allowed to treat JC because we did not feel comfortable. We definitely voiced our opinions. But when it comes to the research of those types of drugs, it happened very fast. And when you look at it again, 520 days seems like it's a long time. It's not. It's not. If our daughter had, from the time she was diagnosed, 520 days to live, and we had no idea. Had we known that, we may have acted differently. We may have done things differently, but you don't know that end date is there. And, that had we known about that drug, that's what that drug did, that may have been the only course of action. That may have been the only option for her in her state and for her type of diagnosis and things like that. But I think looking back at it now, again, 520 days, we were in shock pretty much the entire time. We were tired. We were worn out. We were burnt at both ends. We were trying to, juggle, a life, a marriage, a house, 2 other children going to school, trying to keep JC up to date with her schoolwork while she was at home, dealing with COVID, dealing with work being weird because the whole state and the world is shut down. And there was so many factors that were happening all at that one time, that I feel like we did miss a lot of opportunities, and a lot of opportunities to maybe make a change, maybe an opportunity to stop one treatment or start another, or maybe alter what was happening. And there's no way to tell if any of those decisions or any of those choices made a difference, yes or no, for Jace. There's no way to tell if any of those made the ultimate the ultimate decision, the ultimate choice that made that was the factor in that. There's no way. But that's why I like to use this podcast. I like to use social media. I like to use those opportunities and those avenues to speak up against what we went through and what we felt and what we did and what we feel like you could learn from our mistakes, or you could learn from what we went through. Because when we heard this diagnosis for the first time and we were going through all of this with Jace, we were the only ones. I have one friend that I went to school with, I went to high school with, that their son had a brain tumor, and that's as close as we ever were. And we don't live anywhere near each other, but that's as close as any kind of connection I had to any type of childhood disease. That was it. So this was something that we're basically alone in this world, alone, not knowing what to do, what to say, who to call, how to react. I was getting advice from little things, trying to figure out how to make sure her chemo was smooth. And these are all things that were very hard to monitor or very hard to kind of manage because we were alone in a world that we had no idea what was going to happen. We didn't have people to lean on. We didn't have a community to bounce ideas off of, or to reach out and look for help and look for assistance. We didn't have that. And because of that, I feel like we were horribly kind of hindered in our fight to ensure that Jace was going to get the best treatment possible. And to this day, we will never know if the treatment she got was perfect. We will never know if the treatment she got was altered. We will never know if the treatment that she got was the best course of action, because we simply just did not have the time and opportunity to really do, I think, the proper research and the proper advocating that we needed to. So this episode is about taking what we've learned and what we've gone through and grow from it. Understand that if we had this chance, if we had to do it all over again, I wish we could just erase all of that and have her live a happy, healthy life. But if we had to go back and we had no choice but to relive it, we probably would do things differently, and we would take our own advice that I'm giving out now. So do what you want with this advice, run with it, but please always be your child's best advocate. Always be their strongest supporter, their strongest cheerleader. Remember that when you're in that doctor's office, you are their only patient. There is nobody else on his schedule but you at that moment, and they don't get to leave that office or leave that room until they've answered every single question that you have. And if they have a problem with it, you find a new doctor, you find a new team. But that's the reality of the situation. Okay, that's your time to fight, your time to scream and yell, your time to make your feelings heard. And I'm not saying they're always going to listen, but you got to make sure that you get that voice out there, and you got to make sure that you let them know that you will not stop fighting for your child, and you're going to do exactly what's best. Because, as I've said before, we as pediatric cancer parents do not get to clock out at the end of the day. This is our daily life. This is 100% how we live, when we live, all we live, and all we know. We do not get to walk away from this. We do not get to change the channel and shut it off. We are going to live it no matter what. So anybody in the medical profession that tells you that they alter the way they talk to you because you won't understand, or they tell you that you simply don't understand or can't because you are not a medical doctor, you're simply a parent, just a normal person that doesn't have a medical degree, I'm here to tell you that we understand a hell of a lot more. We understand way, way more, actually, than what you give us credit for. And we understand it because we live it day to day. We don't get to leave. We don't get to shut the lights out at night. Our child will still be next to us. They will still have cancer, and we will still be getting up every single moment of every single night to make sure that they're okay, checking their levels, checking their blood for them, flushing their ports, giving them medicine, changing feeding tubes, whatever we have to do. We're doing it round the clock. We don't get to shut that off. And that's why our knowledge, I believe, far outweighs that of book knowledge, because we are living it. And when you live it, you learn so much more and so much faster than when you're reading it out of a book. I said what I said. That's how I feel. Choose to do what you want with it. But just remember, be your kid's biggest advocate, and make sure you speak up if you feel something's wrong. Thank you guys so much for sticking with me through all of these episodes and keeping up with the story and keeping up with everything that I'm trying to get out there and advice. Next week, I have a great treat. I'm going to be interviewing a fantastic friend of mine. Her name is Coral, coming on the show for the first time. I'll have a guest, and we're going to be able to speak about her story with her daughter Luna, possibly about their organization that she created in her daughter's name. And it should be a really interesting episode. So stay tuned, and we will see y'all next week.